So we're talking about degrees of certainty here. The marketing industry has been satisfied with a mild degree of certainty. You know, we possibly misled by the idea of 95% confidence ranges, which really only refer to the sample size, not to biases and so on and so forth. This seems to be the guy, Jabir, back in 721 AD when he was born, 815 AD when he passed away. He was a polymath, mostly a chemist, called himself an alchemist, and he realized that you had to reduce things to a single difference between two groups when you did an experiment, or you wouldn't know how to read the results. So epidemiological or observational research, which is what we're all using, you try to control mostly post hoc for the differences between the two groups. But you're making an assumption, and you don't have all the information that you need, and so it isn't really a controlled experiment. All you are entitled to talk about is two things happened coincidentally. They coincidented. That doesn't necessarily mean one causes the other. So it may look as if medium A or copy A beats medium B, copy B, because that's what happened last time, but it may have happened for other reasons. So how much is it worth to have a little bit more certainty? You know, in the marketing field, we're talking about hundreds of billions of dollars being spent. And we can also observe degrees of success in the world. It's very down to earth. You know, data scientists, direct marketers, e-commerce professionals, the new direct-to-consumer companies, what do they all have in common? They all do experimentation, controlled experimentation. Most marketers don't. And what are the CMOs who don't use it have to show? An average of 23 months in the job before they get canned? And it's pretty obvious that we really do need this higher degree of certainty. Back when I had TRA, back in 2011, ARF did a research review. We said many, many times that we are using an observational method. We're looking back, and we should only use this to form hypotheses. Then we should use A/B testing to confirm the hypotheses. The ARF, in their research report, encouraged that approach. None of our clients used it. They just bought the observational data, made decisions, and went on happily. Fortunately, many of them benefited, but some of them could have and didn't. One relevant finding from the work that I've done in this field is that today we've got addressable TV and digital, which lend themselves very well to A/B testing. We also have zone targeting, which has some ability to do A/B testing. Now, the problem that often occurs is you can do a perfect A/B test, but you can't stop the fact that you've got a national advertising campaign going on in the background. That's going to compromise a perfect A/B test because you've got something you can't control, which is falling on the two groups any way it may fall. So we came up with a workaround where we can look at, these are fake numbers. So people who are unexposed, no change in sales. People who only saw the nationally running commercials, small sales effect increases. Now the people who saw the new commercials being tested in this A/B test, the numbers going up. So adding a little bit more certainty, but still it's not a perfect A/B test. The perfect A/B test will be able to be done better starting in 2020 with ATSC 3.0, when broadcasters can actually, you don't want to have your commercials reach these people because you're doing a clean test, we'll just cut them out, pressing a button. That's on its way. Now, Walmart is doing some great A/B testing at Sam's Club. And what you're looking at here are the differences between A and B. So these are the differences between the different brand messages. And what we see here, this is done by a company called 605. They measure full funnel. So they measure the things like awareness and purchase intent. They measure actual sales transactions from Walmart sales data. So you're able to see here, this brand message B was very good in persuadable shoppers particularly, but not in terms of sales. It had branding effects, but not sales effects. And you can actually go to the bank with these results because they're experimentally derived. causality. 605 and my company, RMT, are developing a study which we invite participation in through the ARF, in which we want to use, there used to be a thing called the truth standard, where you could compare, back in the old days, it was the telephone coincidental. So it had very low non-cooperation. You were able to get big sample sizes. It was inexpensive. And you could say, okay, this is what the coincidental shows, method A, method B. So you can do methodological research against the truth standard. We haven't had that. But the A/B test is a truth standard for all the attribution methods. So we want to look at different algorithms for attribution and see whether they have persistent either agreement with or disagreement with the truth standard. This is a slide that we're going to be showing a week from today between 1 and 2 o'clock on an ARF webinar that's free for all ARF members, in which we're talking about our psychological, RMT psychological system, driver tags, working with IRI and Viant, to be able to target people who have the same psychological motivations as are in your ad. So it's based on content analytics of your ad. And the method's been validated by Nielsen Catalina and others, but we want to see it validated by A/B testing. So thank you.
Thank you. Thank you. Wanted to reflect on the past experience in this field. I probably should rather reflect on my personal stupidity and going into different building. So it's been about a year since I haven't been in the trenches of this particular field. It gave me enough time to reflect, look back, and so I will not talk about the results. Margaret and Mattia will talk more about what IS is doing in this area. The way I look at it is through the looking glass. And I would like to actually first understand how we got here, that we, about 25 years after the EdTech was invented, we are discussing very fundamental things that pretty much don't exist. And I think that it started with the complexity of the system. Nobody on advertiser side ever understood 25 years ago how this media is bought and sold technically. And advertiser was immediately removed from actually buying and selling. It was intermediaries, technology people, mostly networks that implemented everything. At that point, there was practically no technical means to run A/B testing. We are just arriving at these capabilities. Fortunately, we have them now. And in this environment, measurement became what's possible rather than what's right. It was defined by engineers rather than by economists and marketers. You can imagine in common sense in real life, if you are told that you don't have range, you resort to cooking in a microwave or going to fast food, and you compromise the quality of food. Back in the day, when I was in Soviet Union, we were denied free TV and free press, so most of people started believing in propaganda. And when you start believing in propaganda, you start behaving in a very strange way. You stop questioning things that 20 years later seem like an absurd. We are not far from there in our industry. The worst thing is that people believe in wrong concepts, live by them, and most don't even question them. Even worse, the livelihood of too many people depends on the status quo. So there are kind of nuances and subtleties in terms of what's wrong and what's a misinformed measurement. We know that most of advertising is not properly measured for various reasons, mostly because it's simply very, very difficult to run A/B tests in TV, in print. But at least there is some sense what is going on, where we should be. And the incentives are not necessarily super misaligned. Nobody wants to run millions of ads on TV or print across every single magazine. People are selective. In EdTech, the wrong measurement led eventually to wrong incentives. Instead of measuring the outcomes, we started measuring clicks, impressions, other things. We consistently make wrong decisions in terms of how much to spend, where to spend. That leads to wasted budget and well-known criminal activity, so much fraud. When we have wrong measurement, the system gets broken, and there is much closer to everybody's experience here, which is our healthcare system, where it's not that far, actually. If you think about it, how the success is measured, it's not measured by how well we are treated. Because it's hard to measure, but it's also not incentive-driven, right? So instead of measuring incremental effect of treatment on patients, we use proxy outcomes, basically how many medical procedures were done to you. And that drives the wrong incentives, unneeded procedures, expensive equipment, and so on and so forth. We get a broken system, rising insurance premium, reduced coverage, things like that. Everybody experienced this. We have by far the highest spend per capita as percentage of GDP across all developed and probably not only developed countries. That's where we are. And this is all because of ultimately wrong measurement. So fortunately, at least technically and mentally, there are people here who can do the right thing. How do we move towards the change in the paradigm in the industry? And I think that there is kind of a concerted effort, but it's also the right thinking. We need to start thinking about what's wrong, what's right, what's wrong. We need to listen to economists and think about what incentives it will drive, what the consequences or implication of these incentives, whether it will drive another round of fraud, or it will eventually drive the right behavior of participants in the market. We need to actually, even though the A/B testing is very attractive, we need to still be honest, admitting that you can't really apply it everywhere, not at least now. We need to think how we incrementally improve, no pun intended, incrementally improve rather than hope to always do breakthroughs, and sometimes compromise and give up on scientific purity, being myself a scientist. We need to be aware of limitations of any measurement. We are in an environment that not everything depends on us. We live by cookies. Cookies are not people. So the same person will be exposed and in control and an exposed group because of cookie churn. We have walled gardens that none of us probably can touch. There are other channels, TV, print, that so far not necessarily are accessible by EdTech technologies. We have challenges getting the offline outcome data, and so on and so forth. So in giving up purity, sometimes I mean that, and the IS team will probably speak about it, that despite the fact that observational studies are not as sound as RCTs, sometimes it makes sense to combine them if you can overcome some of the limitations. And whenever we introduce something new, be aware of potential conflict of interest. If you rely on a DSP to run ghost ads, that DSP is incentivized also to get more media, right? To run more media. So it's an old story with conflict of interest. I want to actually, I ran across one of the very early meaning last month, studies published that is one of the first manifestations of using actual electronic health record data to supplement the clinical studies, the clinical trials. So the clinical trials happened a couple of years ago, and then electronic health records were collected for about a year for cancer patients. And the point here is that the group that conducted this study and published it didn't claim that you have to replace it. But it's a good example of how you can complement the clinical trials with real world data, health record data, and sometimes actually discover that maybe clinical trials weren't all that correct. We are not curing cancer here, but we can learn from there just as that industry actually learns from EdTech. I want to also finally give you an idea of what a thought kind of experiment where not having access to certain channels may lead to wrong decisions. And I think that's the core, what we need to think when we start driving or moving towards the right measurement. It's not guaranteed that the right measurement will always drive the right decision. Hopefully it will ultimately drive the right incentives, but not always the right decision. Think about a campaign that run, or the marketing campaign that is run on display ads and on TV. We can run A/B testing or RCTs on ads. We are blind to TV for now. So what we observe is not of course, the baseline of population, but baseline that is influenced by TV. And suppose TV actually leaves the baseline, so that effective lift that we observe through RCTs on display ads is relatively small, and ROI is nearly zero, right? So if you do that, the conclusion is cut the budget on display ads because it doesn't drive the positive ROI. However, what if you instead ran an RCT on TV and held the budget on ads without running RCT on ads? What you will see is that actually the baseline TV baseline is now lifted by ads. You have much smaller lift on TV. You spend a lot more money. The right decision, if you were able to run this, would actually be reduce the spend on TV, which is more expensive and lift is not proportionally higher, but instead run the ads because they provide significant lift and positive ROI. And that's the point of being blind to certain channels or certain parts of the media, walled gardens, where not always the RCT is the direct decision driver. That's it. Thank you.